Hi there, Amy Shields here. This is my week 8 presentation of the patient. Mrs. Jones is a 50-year-old female with no past medical history. She comes into the office with a chief complaint of low back pain for the last 3 days after lifting a patient at work and she felt a pop. HPI includes that the patient describes low back pain with the pain into the buttock and radiates down the left leg into the calf and foot. Characteristics are described as constant throbbing and radiating down the left leg. Aggravating factors are sitting and walking up the stairs. Relieving factors are rest and medication. She states that she has tried ibuprofen 400 milligrams every 8 hours as needed, which she has been doing consistently since the pain started and has not been effective. She states that the pain is constant and she rates the pain 7 out of 10. Medication she takes is only the ibuprofen 400 milligrams every 8 hours as needed for pain. Patient has no known drug allergies. She has no past medical history, and the only surgical history is a partial hysterectomy in 2010 due to fibroids. Family history includes that her mother is deceased in 2020 due to complications of COVID-19, and she had a history of asthma and was a smoker. Father is alive and well at 86 with controlled hypertension, also a smoker, and a long history of depression due to the wife passing away. Social history includes drinking wine occasionally, no cigarettes or substance abuse. Review of symptoms, negative for weight loss or weight gain, denies fever, chills, fatigue, or night sweats. Skin is unremarkable. HEENT, breast, lymph, heme, endo, cardiovascular, and respiratory are all negative. Patient does not have any chest pain, dizziness, shortness of breath, or syncope. GIGU, negative for nausea, vomiting, diarrhea, or constipation. Patient denies any dysuria or frequency. Patient denies incontinence or loss of bowel and bladder function. Patient denies any muscle weakness or loss of range of motion. Patient denies any fainting, seizures, headaches, weakness, or paralysis. No depression, but patient does have some anxiety. Vitals are unremarkable. Weight is 110, height of 5'6", BMI of 18.9, so the patient is underweight based on her BMI. Physical exam is focused on the neurological and GIGU due to the back pain. The patient is learn-oriented to person, place, and time with normal speech. Appears clean and well taken care of. No motor deficits are noted with muscle strength 5 out of 5 bilaterally. Sensation is intact bilaterally to the lower extremities. Decreased forward flexion of the lumbar spine. Straight leg raise was limited to 45 degrees on the left side. A sciatic stretch test on her left leg had positive results, and response to light touch and pinprick were reduced on the lateral side and over the dorsum of the left calf. Dorsiflexion of the left foot showed slight weakness, grade 4, and the right ankle jerk reflex was reduced. Straight leg raise was negative. GIGU, no incontinence or loss of bowel and bladder. All other symptoms are unremarkable. My assessment plan for this patient is because of the back pain and the injury at work makes me think of something neurological or musculoskeletal. She felt a pop after lifting a patient with the radiation down the leg, which makes me think of sciatica or herniated disc as the most probable diagnoses. Other differential diagnoses that I'd like to rule out would be a compression fracture, herniated disc, and musculoskeletal back strain. The compression fracture could be due to the low BMI. Herniated disc can happen, which the fluid leaks out of the disc or it slips out of place and puts pressure on the nerve, which can be ruled out on the MRI. The back strain is a pulled muscle, which could have happened when she lifted the patient. Diagnostic studies that I would do would be a CBC to rule out infection, BMP before using Toradol and Celebrex, MRI to rule out the herniated disc, and X-ray to rule out the compression fracture. Final diagnosis is sciatica because it is an acute event only occurring 3 days ago. Sciatica causes inflammation of the nerve root, compression of the nerve or even disc prolapse. The pain is unilateral and likely symptoms include pain in the L5 to S1 area with pain down the leg. Because the MRI was negative, we could rule out herniated disc. Medications, I would give her Toradol 15 milligrams IM in the office and then start Celebrex the next day, 200 milligrams PO daily. I would also order Robaxin 500 milligrams PO every 8 hours as needed for muscle spasms, and Tylenol 500 milligrams 3 times a day routinely. I would refer her to physical therapy, patient education. I would encourage her to continue to exercise, especially walking, low impact exercise such as swimming and stationary bike. I would encourage her to start PT. I would encourage her to alternate ice and heat, 20 minutes on every hour. I would educate that she should stay home from work for 1 to 2 weeks or until symptoms improve. And I would encourage her body mechanics, especially with her job of lifting patients. Cultural considerations include to discuss with patient to make sure that she has enough family support or other church family to help her while she's laid up. Health promotion, I would make sure that she's up to date on immunizations and order any other screenings that she needs, such as colonoscopy, pap smear, or mammogram. And I would have her follow up with me in 1 to 2 weeks to make sure things are improving and to release her back to work if in fact it is improving. Thank you.